I got it's coronavirus day 450 and it's still like the 11-day rule out until before phase 1 officially starts. So please do not have any gathering due to risk due to risk and a possible wave 4 which might happen actually proven to by doctors and healthcare professionals. Not just Dr. Peter Juni and Dr. Lawrence Lowe. Others also have talked about this, and yes, it might happen. So please do not have any gatherings above 5. So yeah. So today's coronavirus case is at 744. Okay, so a bit lower than yesterday's. Okay. So good way to end work basic week, I guess. So before tomorrow, so 181 cases are from Toronto, 123 cases are from Peel Region, 61 is from Hamilton, 51 is from the Waterloo Region, and 48 is from York Region, and also 48 is from Porcupine County, which had been on this list for the last few days actually. Like, interesting. So this is like somewhere near Timmins, I've been told. So 24 deaths have been reported today. So yeah, variant cases. So UK variant is at 131,123, an increase of plus 1,316. South African variants are at like 1,035. Finally, so an increase of plus 63, and Brazilian variants at 3,263. Yeah, of course, it would end up there. Yeah. So and plus 296, and the India double-mutant variant, aka the Delta variant, as its nickname is clarified as of the WHO. Since WHO is using the new nickname thing, so Alpha for the UK variants, Beta for South African variants, so Gamma for the Brazilian variants, and Delta for the India double-mutant variants. So I've been looking at it. So yeah. So the Peel, it's affected the Peel region at 97. So yeah, and Peel region is hit the hardest right now. So we need to fix the Peel region first before we do the stuff anything after that. So vaccine bookings, if you want to book vaccines, for 12 up and up right now, if you can pre-book for your second shot if you're 70 plus as of yesterday, and yeah. So COVID-19 ontario.ca/book vaccine 1-888-999-6488. At a pharmacy, you will have to wait. Do local health unit networks So, youth 12 to 17, they can also do it through special dedicated youth and family clinics. And on Tuesday, they can also do it at pop-up clinics, mobile clinics, and walk-in appointments on Tuesday. So youth not age 12 and up they can call 1-833-943-3900 or to public health units. So what I want to talk about is today is so the Ontario government asking for a stronger border enforcement plan again because it's going to the variants, especially the Delta variant, is going to ruin the provincial reopening plan. The three phase plan. Yeah, so that's going to delay it. And so if they're the cases get worse, they're gonna push it back a bit more. So that's the problem right now. So So Health Minister Christine Elliott and Solicitor General Sylvia Jones that they noted that the province is concerned about the risk of international travel during the third wave of the pandemic. Yes. Doug Ford has asked the federal government to strengthen border enforcement before, last month. And he did this last month, saying that the infectious coronavirus cases and all coronavirus variants are threatening, affecting the province, and we need to do something about it. And yeah. So they called for so Christine Elliott and Sylvia Jones they called for a federal requirement that fully vaccinated international travelers present proof of immunization and take a coronavirus test on arrival. So international travelers who have not been vaccinated against the coronavirus, a stronger quarantine regimen should be in place. The state recommend asked and both of them say that Ontario is committed to working with you to do whatever it takes to protect Canadians from the variant pandemic and future variants. And we urge you to heed these concerns and act now to finally secure our borders. Yes. Yes, it's a big major concern because there are domestic flights, like flights from province to province coming into Ontario, and then there's international flights, like flights from USA and also from other countries, from countries like from Asian countries, the European countries, African countries, Australian, South America, Central America, and per flight there has been at least one or more people who have been has brought the coronavirus or the variant with them into yeah, and also the international flights. The requirement is you either land for international flights into Canada. You either land in Vancouver, Calgary, on Toronto, the Pearson Airport, or the Quebec's Dorval Airport, and Calgary and Dorval. They don't really, they haven't really they just let people in while Ontario and British Columbia, we have taken it seriously. But people should we should it's important that we secure our borders, because if you just let people just in, just it's just going to increase risks, and a wave 4 will come way sooner than fall. And of course, they're going to, we won't be free from coronavirus. And as Dr. Peter Juni has mentioned, so we'll have three major problems and fall. That's going to be like the common cold, flu, and coronavirus as it gets worse. So yeah. And hopefully we might, yeah, and I don't want to see a fifth variant from somewhere around the world forming, and then ending up in some place in the world and then ruining our lives. So, but that might happen. So we need to literally make sure and then there's the problem with some people choosing not to get vaccinated. Like it's like my body, my choice. Those people, I know, I hate to call these people stubborn people, but yeah, well. But honestly, it's it's good to that people should just vaccinate themselves, then for the greater good, because it's not just about yourself. Stop thinking about yourself and thinking about the people around you, and sort of you gotta think outside the box, and yeah. And of course, don't forget about the mental health. People, yeah, it's children. Think about the children too. You know, we need to have a safe reopening as in September, and if people choose to not do that, look where we're going to go into. And don't forget about Pure Region with the Delta variant. And Bolton, Ontario is still affected by the UK variant. Even though they got affected by 10% of people, they got vaccinated. You know, they still need to get their second shot. Yep. So officers still have the authority to break up gatherings. You know, $750 per person. If you like, there's more than 5 people. $880 through ride checks if they're still in effect. $1,000 for preventing others from following orders. $10,000 for those who organize or plan the gathering, and $1,000,000 if it gets severe, and possibly jail time. And of course, health. So, 625 people are hospitalized with coronavirus now. Okay, that's better than last time's number. It's been lower than last few days. Okay, so that's good. So 516 are in ICU, -6, and 362 of them are on a ventilator, +5. Okay, but still better than April and May's cases. So that's better. So we're sort of like going down a bit. But let's not forget about the variants. That's our biggest concern. So there's no information about the long-term care homes. So I still have yesterday's data, like from yeah. Like May June 4th, like 4th. Hopefully they'll update it tomorrow. Sometimes they show it, sometimes they don't. I think the government's being shady. So please follow coronavirus safety rules and regulations. And the 11-day rule, and please do not have any gatherings over 5 for the safety of others outside. Indoor gatherings are not allowed right now until phase 3, which will be sometime around mid-July, August by my estimate. So hopefully it might come earlier if if things go well. Stay safe. Sign up for vaccinations if you haven't. And also, since 70 plus the vaccination pre-booking that had been shifted earlier, it might come for like 65 plus or like or whatever age category it is. That might come way before June for the week of June 14th. So yeah, I'll see. I'll let you know when that is. Stay safe.